What temperature is considered a fever for a child? Imagine your child playing happily 1 minute and feeling warm the next. Knowing when their temperature is a fever can help you decide if they need extra care. A fever in a child is generally defined as a body temperature of 100.4 degrees Fahrenheit or higher when measured with an accurate thermometer. This is the standard used by most health authorities and helps parents understand when their child might be fighting an infection or illness. Normal body temperature can vary a little depending on the child's age, activity level, and time of day, but usually it falls between about 97.5 degrees Fahrenheit and 99.5 degrees Fahrenheit. If your child's temperature reaches or exceeds 100.4 degrees Fahrenheit, it indicates a fever, which often signals that the body is responding to an infection or other health issue. You can measure your child's temperature in several ways. The most common methods include oral, rectal, ear, forehead, or underarm thermometers. Rectal measurements are often considered the most accurate, especially for infants and young children. Sometimes a child may feel warm or appear flushed, and if a thermometer isn't handy, feeling their forehead or neck can give a rough idea. But remember, a thermometer provides the most reliable information. For infants younger than 2 months, a fever of 100.4 degrees Fahrenheit or higher should prompt immediate medical attention, even if they seem otherwise well. This is because young infants are more vulnerable to serious infections. In older children, a temperature above 101 degrees Fahrenheit combined with symptoms like rash, vomiting, or difficulty breathing should be checked by a healthcare provider. If your child has a fever but feels energetic and comfortable, it might not be necessary to keep them home from school or activities. However, if they are irritable, lethargic, or showing other signs of illness, it's best to consult a healthcare professional. Remember, fever is a sign that the body is fighting something, but it is not always a cause for alarm. Monitoring your child's temperature and symptoms closely can help determine when medical advice is needed. Always trust your instincts and seek professional guidance if you are unsure or if your child is very young or very unwell.